Meantime, Arizona lawmakers going behind closed doors last night, drafting a plan earmarking millions of dollars to keep women from having an abortion.
The last-minute move coming as national momentum grows toward making it tougher for a woman to have the procedure, and the potential of Roe versus Wade going back to the Supreme Court.
Our own Justin Pizzera at the Capitol tonight following our state's new proposal.
Yeah, good evening, Steve. A lot of these folks did not find out about the state's plan until late last night, so they had to quickly regroup to be back here at the Capitol early this morning to talk to these lawmakers. Now, this plan would appropriate $2.5 million for the next 3 years for this pilot program. It is called the Family Health Pilot Program, and it will specifically target pregnant women.
It's a trip to the Arizona State Capitol Zoe and Ephraim didn't think they'd be making today.
Not the church, not the state.
They were just here yesterday for a rally that brought out several hundred protesting a new wave of anti-abortion laws being adopted by other states. They found out late last night 2 bills were being introduced today in Arizona.
I feel like this is something that we constantly have to do. So the idea of spending taxpayer dollars on a system we don't have in place and know will not be effective is ludicrous.
The plan is spelled out in 2 bills making their way through the legislature, allocating $2.5 million to start a family health pilot program that would be funded for 3 years. Kathy Harrod heads up the conservative advocacy group Center for Arizona Policy, the group pushing for the legislation.
The Family Health Pilot Program is modeled after a successful program in Texas that found good success at reaching women who wanted to know about abortion alternatives, but they just did not know how to find out that information.
Harrod says the program would use sophisticated marketing techniques to approach the pregnant women.
It's over the internet, it's over the phone, plus it also, I believe, is in-person services.
The program would require the Department of Health Services to distribute the $2.5 million to a nonprofit that would implement the statewide system, encouraging healthy childbirth. It would also support childbirth as an alternative to an abortion, promote family formation, and increase a family's economic self-sufficiency. Taylor Tucker is with Planned Parenthood Arizona. She says what's happening in states like Alabama could easily affect Arizona.
Once Roe v. Wade is gone, once these protections are gone, if we're not fighting here at the state legislature today, we're going to go back to a time where it's criminal and punished with 5 years in prison.
What's going on in the South is not an isolated incident, and it's going to continue to go to other states like Arizona. So it's really important that we speak up now.
So within the last 30 minutes, Kathy Harrod did testify before the Senate Appropriations Committee, and one of the big sticking points is if some of these providers and if these people that are going to be providing this advice are licensed. Some of these lawmakers did ask her about that. She said that she was not aware and that she would have to get back to these lawmakers. But this plan did pass the Senate Appropriations Committee just within the last 30 minutes, 6-4. It now moves to the full Senate. We're live at the state capitol tonight. Justin Pizzera, ABC 15, Arizona.
Dark clouds.